Welcome to My City Talks, a podcast powered by My City, My Health. I'm your host, Corey Dion Lewis, and we are getting into real conversations that matter to our communities, from health equity and social impact to the voices often left out of the room. This is where we listen, learn, and lead. So grab your coffee, get comfortable, and let's talk about what's really going on in our cities, because change starts with the conversation. Hello, everybody. Thank you for listening to My City Talks. This is the podcast powered by My City, My Health. And I'm here with the homie. Why in my mind, I was about to say the Broadlawns bomber. I'm going to.
It's a good one to me.
We're not doing that. It's like I was going on like this bait, like, and she's next up to this.
I love an introduction.
Sarah Donovan is here with me from Broadlawns Medical Center, home team. So, and also on the Food Insecurity panel at this year's My City, My Health. So, Sarah, thank you so much for being here. I really appreciate it.
Yeah, thank you for having me, and I'm excited for November.
Yes, yeah, and it's going to be here before we know it. So, before, we kind of get into kind of talking a little bit about what we'll be talking about on the panel, because I'll be the moderator for that panel. Can tell us a little bit about yourself, what you do, what brought you to Des Moines, what brought you to Broadlawns.
Yeah, happy to. So originally from Lincoln, Nebraska,
Okay.
moved to Des Moines for college. So I went to Drake University. I studied biochemistry, cell and molecular biology there,
Okay.
and got really interested in public health. So then went back to Nebraska, got my master's of public health in epidemiology there, and then am a PhD candidate there currently.
Oh, nice.
Yeah, so that's been fun. So my education kind of came back to Nebraska, but then saw the job opening at Broadlawns, was really excited to get back into access and engagement work, and so then have been there the last year and a half almost.
Yeah, I know. I will say, like, so I was on one of the interviews,
Yes.
right? And it was like the way you were talking about it was like, oh my gosh, you knew what was going on, and it didn't feel like oh, does she still live here? Like it felt like it was so cool, but that was kind of really like, okay, she really wants to be a part of the community. It was more than just like, okay, I want to know what I got to know for the interview.
Absolutely. Yeah, I loved my time in Des Moines and was really looking for an opportunity to get back here. And so this just seemed like the perfect opportunity to really mix my professional interest and my desire to be back in Iowa.
Yeah, no, that's cool. So walk me through like just a little bit about what your role is so that people can kind of know like how does what you do make sense with the food insecurity panel?
Yeah, happy to. So my role has kind of an internal facing piece and an external facing piece. Internally, really want to make sure that all Broadlawns employees feel like they belong in the organization and promoting that within and across teams. Externally, though, really working to address the social drivers of health and then increasing access to care. And so food insecurity directly plays into that.
Yeah.
Mm-hmm.
We had our meeting yesterday and I was doing some research on it. Yeah, a little bit more, just kind of going in depth. And there's when we're talking about food insecurity, right? In Des Moines or wherever, but specifically for Des Moines, there are so many different layers to it.
Absolutely.
It almost makes it to answer the question, how do you eliminate food insecurity in Des Moines, is not only already a loaded question, but like there's so many levels to it. From, you know, from a population health perspective, like what is our goal for, this year's conference? What are you hoping people kind of get from our conversation when we're talking about maybe some of those different layers of food insecurity?
Yeah. So I think really wanting to increase awareness of what already exists in our community, what services are available, what resources are available, how can people access them, and then how can we make them more accessible? How can we reach and make those services more accessible and those services more attainable so that we increase access to food across the community?
Yeah, no, that's real because there could be a service right next door to a community that needs it and they would have no idea.
Yeah.
Um, no, I really, really appreciate that. When to kind of go away from the conference a little bit, with everything that you do, one thing that I've noticed is we talk about these services in the community, but there are also employees that are a part of those communities.
Mm-hmm.
And it's like, how do we address the food insecurity within the company?
Yeah.
I'm not talking about Broadlawns. I'm just talking about like in general. Like, yes, there may be people at Broadlawns or people at that work at Casey's or insert whatever company,
Mm-hmm.
but they're facing insecurities too.
Yeah.
And we're seeing them day to day, and like they're the work homie, and we're just talking, everything's cool, and they're going home and not having anything to eat.
Yeah.
Um, how do we address that? Is that something we can address from the inside?
Yeah, I think it's important that it maintains its importance internally too, and so that it's an employer priority. And I think there are a lot of different ways organizations can go about that, but I think the first is getting data and getting to know your employees. So
Hmm.
the way at a hospital that you get to know your patient demographics and their determinants of health, how can we do that for our employees? How can we create ways that they feel safe to express their needs? So whether that be housing insecurity, food insecurity, they don't have transportation access. How do we open communication channels so that they feel safe sharing those concerns? And then what can we do on the flip side to address those concerns? Something we're really excited about at Broadlawns is the start of our Employee Emergency Fund Committee. And
Oh,
so that is going to be sponsored by our foundation, but it provides financial assistance to employees who are facing an unanticipated hardship. So, for example, somebody can't afford their rent for the month due to an unanticipated hardship, they can apply for funding from our foundation, and that'll directly support their need. And so I think there are ways that we can brainstorm how we can support employees better and how we can meet them where they are.
that is so cool because and I had that situation where
Mm-hmm.
granted it wasn't an employee, it was a individual that I was serving
Mm-hmm.
that couldn't focus on their chronic disease because they didn't know how they were going to pay rent.
Yeah.
And having that burden on you amongst everything else, but having a resource, oh my gosh, just writing down a phone number for her to call to get assistance was like such a relief.
Mm-hmm.
Um, no, that's really, really cool. Uh, let's, I want to talk a little bit about you because I know you're from from Nebraska,
Yeah.
right?
Yeah.
Right. I got a homie that lives in Lincoln.
Yeah. I
Um,
loved it there.
Football's great. Like, so this is a side story.
Yes.
Okay, so
I'm a big Husker fan, so I'm all in.
so he's lived up there forever, and I came to visit. This was before he moved up there. We were still in college.
Hmm.
We came to visit his uncle, who's lived up there forever. This was a Saturday.
Yeah.
We drive in Saturday morning, and it is a ghost town. I'm like, where is everybody at? He's like, man, football game, bro.
Yeah.
Like, the city was shut
There's
down.
nothing like Memorial Stadium on a Saturday. It is a different kind of experience. Yeah, a whole different level.
Yeah, that's crazy. So, I asked that. So, like, what is it, or is there anything you feel like you can take from your past experiences, from like maybe how you grew up, the community that you witnessed in college?
Hmm.
Are there parallels, or there connections that maybe that we can see and we can implement in Des Moines? Because there's something I say this all the time. We can do, a My City, My Health conference, and every city in the country have the same topic, and the conversation could be totally different,
Yeah.
right? What does that look like? Are there any parallels that you can see? I'm sure there are different challenges, but what are some things that you feel like you can carry to here that can help, support the mission?
Yeah, I think throughout my upbringing and then even in my time at college too was the idea that food is community.
Mm-hmm.
Like so many communities surround food as a way to celebrate your culture, as a way to celebrate different events or milestones, and it becomes kind of the hub. And so how
Right.
can we prioritize food as a cultural piece and make it accessible and relevant, and how do we also then tie into the nutrition piece? So how do we take those things and how can we tailor those interventions that we're trying to roll out to be more applicable to the communities that we're working alongside? But
Mm-hmm.
then I think my real interest in food access started at Drake University. I was a part of the Leadership Education and Development Program. They got a Kickstarter grant from Wellmark to start the little food pantries,
Oh, cool.
those blue boxes that you see around
Yeah.
town. So I was on the capstone group that helped roll those out initially across the Drake campus, and then we had 7 additional in the Drake neighborhood. And so that was really eye-opening to me, is working with community partners. How do we get this off the ground? How are we stocking this pantry? What does it look like? What kind of foods do we make available? And how do we ensure sustainability?
Yeah. What did you learn from that? Like, 'cause I'm assuming, I could only assume that depending on what community that was in, maybe the food needs may have been different, or was there anything that you learned from that experience?
Yeah, that one was an interesting experience because you are pretty limited on what you can supply in those pantries because they're not climate controlled.
Oh,
And so
yeah.
really thinking through what kind of non-perishable goods can you put in there that are nutritionally dense, relevant to the communities that we're trying to work alongside, but don't require refrigeration, can sit out for potentially days or
Yeah.
weeks if no one stops by the locations. And then it was also, who can we partner with? Who can help monitor these boxes for us? Who would be a good donor for these boxes? How do we ensure that this continues? It becomes a lasting effort.
Right, right. The one thing I've noticed after talking to you, other panelists at My City, My Health, other conversations that I've had, everything comes back to partnership.
Mhm.
For the most part, when we're talking about tackling huge issues, partnership always is in the conversation.
Mhm.
What does partnership look like for our community and for food insecurity?
Yeah, I think there are so many different organizations doing great work around
Oh,
food access
yeah.
in the community. And so it's tapping into the resources that we all have. So if you're working closely with a certain population, how do we work with the organizations that they're trusting? How do we get integrated into those communities so that there's trust, that we're building on a foundation of an existing relationship? But I think it's also financial resources,
Yeah.
it's access to different suppliers for food, where are we getting donations, and how can we tap into all of those different things? So for Broadlawns, like our food prescription program,
Yeah.
Food RX.
Hmm.
So I think that's a tremendous resource. And how do we provide education about that? How do we make sure that our community partners are aware of a resource that exists within the organization? And I think that's true of all the organizations. What can the Food Bank of Iowa offer? What is Des Moines Area Religious Council offering in terms of food pantries? What kinds of foods? What are the days of operations? And making sure that we're really, really emphasizing that and then using that to operationalize how we navigate the system.
Right. Sarah, there's one thing that I always come back to that kind of, I don't know the answer for, but when we're talking about closing gaps in food access or whatever it is, um, all of the solutions, um, great solutions, but they're almost kind of like a band-aid, right? Like necessary, but is it going to eliminate or get us closer to that next step in improving or eliminating food insecurities? And I'm curious, with some of the solutions that we have right now, is there conversation? What does that look like from a community perspective? Because this building over here, I don't know what to do about that. But from a community, I'm pointing at the Capitol. Like nobody, no, for
Those who can't see.
those who can't see or just listening, I'm pointing at the Capitol. Um, but from a community perspective, is there a next step outside of just closing the gap with like a temporary fix?
Mm-hmm. And so I think it's thinking about how can we empower people to have sustained access to food.
Hmm.
So beyond accessing a food pantry or just having awareness of when they can visit that, are there other barriers that are restricting them from accessing food? So if we're able to get routine transportation for an individual,
Yeah.
how does that impact their food access? Could that be the real solution to it? Or is it employment? If someone's gainfully employed and has a living wage, how does that impact
Hmm.
their access to food? And so are there ways that we can empower individuals to become their own advocates and
Right.
their own, and really maintain that ability to access resources
Y-
within the community?
Right. And it goes back to your previous point about education and awareness,
Yeah.
because there could be a service out there that, I mean, not could be, there are services out there that can help individuals access, the job market and try
Mhm.
to find them, meaningful work. There are some organizations out there that help and assist with transportation.
Yeah.
Um, but there are things that we can do, but it goes back to, do you even know about it?
Hmm.
And then how do we get you to know about it outside of, and maybe it is that, Sarah, maybe it is just being in their community. Like maybe it's not just having a a resource flyer or something, but pulling up and being like, hey, do you know about these services?
Yeah, I think that's where community health navigators and roles like that become so essential. And so part of my role at Broadlawns too is overseeing the interpreter services department, which has been really, really
Yeah,
fun.
I spoke to them a couple last week.
Yeah,
Hmm.
it's been great. But it's been really fun because they have all or most of them are becoming licensed as community health
Hmm.
workers. And so getting to see that transformation and learning about the coursework they're doing and how they can better support the communities they identify as members of has been really impactful too. And so how do we get people on the ground in their community sharing these resources?
No, that's so cool. That's so cool. Um, let's talk more about this conference. So you weren't able to attend last year. What are you what are you looking forward to?
Yeah, all of it. I'm I am so excited, but I think it'll be such a great opportunity to network and communicate with like-minded
Yeah.
individuals. We're working towards similar goals in the community, and I think there, like I said earlier, so many opportunities for collaboration and to
Yeah.
learn from the successes, but in also area of opportunities that others have identified. And so really excited to be in a space where we're working towards those same goals and we can really navigate these systems together to identify the best path forward.
Yeah. There's something, no, I love that. And there's something so energizing about being around people who feel the exact same way,
Absolutely.
and the ideas are, you can hear it. Like you hear people talking about, hey, we should have coffee and we could talk about this, and just hearing it in the air. It is really, really cool to be a part of. So I'm so grateful that you're a part of it.
Yeah, thank you.
Talking about the food insecurity stuff in our community and being on that panel with Jasmine and Zuli. Um, are there any last words that you want people to um, take away from our episode today?
Well, thank you again for having me. And then I also just want to open the door. So if anyone has any ideas of ways that I personally or Broadlawns Medical Center can work towards addressing food insecurity, I would love to hear them. I always want to be a sounding board for those ideas and help facilitate that within our community. And so just want to be a resource that way as well.
Yeah, and I'll make sure I connect your LinkedIn profile to
Oh,
the
perfect.
description of this episode. Again, Sarah, thank you so much for being here.
Yeah, thank you.
Everybody, thank you so much for listening to My City Talks. Listen, if you heard what we talked about today, there will be more of that November 14th at Curate Des Moines. You can go to mycity.health, see who's on the panel, check out the agenda, and get a ticket. It'll be a great time. Again, everybody, thank you so much for listening to My City Talks, powered by My City, My Health. I'll let you next time.